Speaking of COVID, the BA.5 subvariant continuing to cause a steady rise in COVID cases here in North Carolina. Several more counties in our area have moved into the CDC's highest COVID community level when it comes to community spread. It's how the CDC indicates the level of risk in your specific area. And if you are in the high level, the CDC is recommending masking indoors. WCNC Charlotte's Chloe Leshner has more on the impact.
Half of our state map is turning orange, indicating high transmission of COVID. Each week, the CDC looks at a combination of metrics, including hospitalizations and new cases, to determine each county's risk.
However you slice it, there's a lot of COVID out there.
It's all fueled by the BA.5 subvariant of Omicron, the most contagious strain yet. According to the CDC, 4 weeks ago, only 4 of the 100 North Carolina counties were in the high zone. The next week, that bumped up to 18 counties. Last week, 41 counties were orange, and now the latest data released Thursday shows 50 counties in the state are in the highest level. Mecklenburg County has not moved out of the medium level yet.
Before we get there, if we can continue to get folks engaged and know that COVID is spreading, it's here. And while we had hoped that we'd have a quieter period in the summer, we're not.
Several surrounding counties were upgraded this week, including Gaston, Lincoln, Catawba, Cabarrus, and Rowan County.
And we've seen a slow increase over the last few weeks. So we are not surprised about this, but we are concerned.
Rowan County Health Director Alyssa Harris says hospitalizations are going up, but luckily cases are not as severe and healthcare systems are not overwhelmed. She's seeing a lot of people get reinfected because of the BA.5 subvariant, which has the ability to evade immunity from vaccines or past infections.
We should be encouraging everyone who is in an indoor crowded space to go back to masking, to consider social distancing, and then of course washing your hands, staying home if you're sick. Those very basic things that we can do can really reduce the spread of illness during this time.
Chloe Leshner, WCNC Charlotte.